Are you worried you might be suffering from liver disease or a fatty liver? Then this video is for you. Liver disease is not easy to detect until it is on its advanced stages, so in this video, we have put together 10 signs you might have a faulty liver you should not ignore. The largest organ in our bodies, the football-shaped liver, sits on the upper right side of the upper abdomen, behind the lower ribs and close to the pancreas, gallbladder, and intestines. The liver stores nutrients, removes waste products from the blood, filters and processes chemicals in food, medication, and alcohol, and manufactures bile, which aids in digesting fats and eliminating waste from the body, and plays a role in producing proteins, even enabling blood to clot after an injury. The liver does a whole lot, so it's important to keep this workhorse of an organ healthy and working properly. However, there are things we do that can damage our livers. Liver disease can be inherited or caused by a variety of factors that damage the liver, such as viruses and alcohol use. Obesity is also associated with liver damage. When your liver is in trouble, though, there are a handful of ways it lets you know. Here are 10 signs of liver damage to watch out for. And, as these signs of liver problems commonly stem not only from excess alcohol consumption, but a lot of other reasons as well. You must watch this video carefully to see if you have a faulty liver as early as now. If you are new to this channel, please don't forget to subscribe, and hit the bell button to keep you notified and updated with our latest videos. We are trying our best to give you the most informative health-related videos, regularly. 1. Constant fatigue. Medical scientists have yet to figure out exactly why bad livers make people feel tired all the time, but frequent, severe exhaustion has been associated with liver problems. One important factor is that the liver supplies the body with energy by converting glucose into glycogen and storing it for later use. A compromised liver is less able to facilitate this process when the body desperately needs energy, which could explain how liver diseases might cause symptoms of low energy. 2. Your skin or eyes are turning yellow. Seeing the whites of your eyes start to turn yellow, or experiencing yellowing of your skin, can be incredibly scary, but it has a solid explanation. It's called jaundice. It's due to a high level of bilirubin in the body, which is a yellowish pigment that's secreted by the liver. If you do notice the discoloration, it could be from many different signs of liver damage, from cirrhosis to hepatitis B. 3. You have nausea and loss of appetite. You may feel nauseous after a meal, and you may also lose your appetite. These may be symptoms of other conditions, but when the liver is involved, the problem is with the production of bile. This bile helps to emulsify, or break down, fats so that they can be digested. When the liver is malfunctioning, a feeling of nausea is one of the warning signs. 4. You're a man experiencing enlarged breast. One of the most shocking warning signs of non-alcoholic fatty liver disease is experiencing enlarged breasts if you're a man. It's a very mind-boggling occurrence, but there's an explanation. It's thought that the growth of excess breast tissue, aka gynecomastia, occurs due to an imbalance of the hormones estrogen and testosterone. 5. You've gained a lot of weight. If you're suddenly gaining weight out of nowhere, your liver might be to blame. It could be a sign you have liver cirrhosis, a disease that develops slowly and replaces healthy liver tissue with scar tissue, blocking blood flow through the liver and inhibiting the organ from working properly. 6. Itching. Itching could be a symptom of cirrhosis, the formation of scar tissue, fibrosis, in the liver. Cirrhosis can develop unnoticed until there is liver failure. Or there can be symptoms. Itching, also called pruritus, is one symptom. The itch can be debilitating, with the entire skin suffering intensely for no apparent reason. Scratching might just exacerbate the itch, which is caused by the accumulation of bile acids in the bloodstream. If you experience an itch that covers your body or a localized itch that lasts for days, call your doctor. 7. Changing color of urine and stools. The most common cause of darkening urine is dehydration, which can be remedied by drinking more water. But if you are drinking enough fluid and your urine remains dark, it may indicate a liver problem. An ill-functioning liver can cause bilirubin to build up in the system, which may end up being excreted through the kidneys, changing the color of urine. One should be more alerted if dark urine is accompanied by pale stool. A healthy, well-functioning liver releases bile into the stool, giving it its normal brown color. Stool appearing gray, pale, yellow, or clay-colored very likely means there's a problem with bile production. 8. Bad breath. Fetor hepaticus, also known as breath of the dead, is commonly associated with liver failure. Its unique sweet, musty smell is distinct from other kinds of bad breath. While most forms of bad breath arise from processes in the mouth, such as bacteria breaking down food remains, fetor hepaticus is caused by volatile compounds, which are produced as a result of liver damage, entering the lungs from the blood. Although it's not a particularly accurate method of diagnosis, there are actually doctors who smell patients' breath in order to detect a liver failure. In a 2009 study, researchers from the Catholic University of Leuven in Belgium took breath samples from 52 patients with liver cirrhosis and 50 healthy participants. They analyzed these samples to determine if they belonged to liver cirrhosis patients. In the end, they were able to accurately classify 94 of the 102 breath samples. 9. Lack of concentration. Have you been struggling at work lately? Your lack of concentration might not be because of those funny videos on the internet and procrastination, but could be an actual sign of an unhealthy liver. Two of the most significant functions of the liver are to detoxify and to energize the body. When the blood is overloaded with toxins, which results from a liver that is not functioning properly, your brain can be affected. Pair that with a sluggish metabolizing of energy, this can result in fatigue, which affects mental clarity. This can manifest in subtle signs of forgetfulness or large problems such as slipping into a coma. 10. Sensitive skin. Another early sign of liver problems is increased skin sensitivity. Liver disease patients may find their skin becomes itchy, flaky, or oversensitive to the touch. In some cases, they also notice the appearance of veins through the skin. The exact reason why liver disease causes itchy skin remains unknown, but it has been thought that certain substances accumulate in the blood as a result of liver disease, including bile acids, which may play a role in this type of itch, although no evidence has shown it. Keeping the skin moisturized will help provide short-term relief, but skin sensitivity will probably worsen if there is an underlying liver problem, until it is addressed. Diet, exercise and adequate sleep are the 3 keys to a healthy liver. You must avoid excesses of toxic foods such as alcohol, coffee, and too many refined grains as a general rule. A glass of lemon water can help flush out toxins and make less work for your liver. Also, ramping up on dark greens like broccoli and spinach, together with walnuts, avocado, berries, and plenty of water is very beneficial. Take steps to reduce your risk of the growing threat of liver cancer by having a conversation with your healthcare professional about viral hepatitis prevention. This includes vaccinations against hepatitis A and B. Of course, it's wise to prevent your exposure to hepatitis B and hepatitis C and treat it if you already have it, because chronic exposure can lead to cirrhosis of the liver. And be sure to talk to your healthcare professional if you have other risk factors like being overweight, obese or diabetic, or are a heavy drinker. Regular screening for liver cancer is not recommended, but the American Association for the Study of Liver Diseases recommends it if you are at high risk. Do you know any other signs of liver disease or fatty liver? If yes, please share it in the comments section down below. Make sure to like or share this video with your friends to inform them as well. Please also watch our other health videos to help this channel grow and reach a wider audience. Thanks for watching The Health Room.